Okay, so let's get going with week 3, successful planning and shared goals. It's been said that a goal without a plan is just a wish. And wishing upon a star is not something that we want to do in healthcare. So, what are our objectives for this week? We will explore the barriers to planning and methods to reduce these barriers. We'll identify at least 3 strategies to promote effective change in the care of patients, families, or groups, and establish at least 2 mutually accepted shared goals for the patient, families, and/or groups. So if we look at the first assignment, which is your self-study, the topic is going to be a healthcare problem. So problems exist in all areas of healthcare facilities. We want you to consider a shared healthcare problem you experience in your practice. Describe the importance of the issue or the problem. Identify the steps essential for successful strategic planning. Explore the barriers to planning and methods to reduce these barriers, and discuss the potential results in this paper. So some examples of shared healthcare problem examples could be hospital-acquired incidences or infections, communication issues, physician and nursing shortages, chronic disease care, workforce safety and violence, IT issues, transition of care problems. A lot of places have been consolidating now. What happens when your place consolidates with something else and now all of your policies and EMRs change? There's the whole question about value of healthcare versus volume. What about pharmaceutical costs? Interprofessional collaborations? What about this expert patient that we have now, the patient who goes on the internet and then knows how to treat himself? We have this growing elderly population, and how are we going to care for them? And the aging healthcare workforce. Pay special attention when you read about the proactive planning, the reactive planning, and the inactivism. And which one do you think is the best in healthcare? Some things that we should be being proactive about right now in healthcare is getting a stronger and more robust nursing workforce because of these impending nursing shortages that we hear about, getting more faculty into nursing education. Some things that you can think about when talking about strategic planning at the organization level are SWOT analyses, balanced scorecard, and the barriers. What are the barriers to some of the things that we want and need to change? Here's just a nice little graphic of what SWOT is. So when we're thinking about change, we have to take into consideration what our company's strengths are already, what our weaknesses are already, where are our opportunities, okay, for improvement, and what are our threats. So I just want to talk a little bit about your PowerPoint for this week as well. So as we've been doing in this course, for most of these classes, is we're going to ask you to prepare a PowerPoint presentation with narration and 4 to 5 slides. Don't count the title and reference slide in that count, though. There are instructions in Canvas on how to do the PowerPoint presentation. And then it's going to be on shared goals. So you and the healthcare team, including the patient, and where appropriate family members or other support persons, work to establish shared goals that reflect patient and family priorities and that can be clearly articulated, understood, and supported by all team members. We want you to read and review the learning exercise. It says 8.3 on page 168. And this is in the marquee and Houston book again. So again, this may be different depending on what edition of the text you have. I have the 9th edition, and it is on page 194, but it is called Learning Exercise 8.3. Now, the name of this learning exercise is Using Change Strategies to Increase SAM's Compliance. So that's the learning exercise that I want you to use. So by looking at that, what change strategy or combination of strategies that you have read about do you believe has the greatest likelihood of increasing SAM's compliance? Who would be involved in this change? What effort might you undertake to increase SAM's willingness to actively participate? And describe how you would develop and establish shared goals for SAM. So some of the classic change strategies that you might consider are rational, empirical, normative, re-educative, empower, coercive. Some change theories are Lewin's change theory of unfreezing, movement, and refreezing. I've seen students use this in this particular case study. Lewin's theory of driving and resistive forces, and a contemporary adaptation of Lewin's model. And then, as always, just a couple more questions to ponder. Do you know of any plans at your current facility to be proactive about this upcoming nursing shortage? When all of our baby boomer nurses retire, have they been involved in any internships or mentoring programs or partnering with schools? There are more than 500,000 seasoned RNs anticipated to retire in the next 2 years, with a projection that we will need to produce 1.1 million new RNs for expansion and replacement of retirees. So, despite the mixed signals, opportunities for RNs abound. A lot of reform initiatives are increasing emphasis on primary care prevention, wellness, and chronic disease management. So it's not just the hospital that nurses can work in. Community-based care is growing, and specialties such as geriatrics, informatics, and care coordinators are blossoming. Can you think about what was the last planned change or transformation that you remember experiencing in your workplace? One of them that I had was a change in from the EMR that we used, and it was a huge transition. Has your facility been educating nurses on how reimbursement strategies directly and indirectly affect their practice? So a lot of things have changed. We have patient experience surveys that people take, and if the scores are not good, hospitals are penalized for that. Depending on our core measures and how successful we are in meeting those goals, hospitals can be penalized for that. And this last picture is actually a picture of a change. It's the same beach looking at the same big sand dune, I guess, just about 10 years apart. And you can see how nature has whittled away that. Beautiful change, though. Thanks, and have a good week.